The first thing, people have been giving you maps of a territory, right? I mean, just the whole business of graves has been going on, as you saw, into the past century. And each century and each year of each century, there was a map offered as to what was going on. But the territory kept changing. And so this, I think, is an important thing for you to consider. The map is not the territory. The map is constructed by some people with technology at a certain time, but within hours, the territory has changed. It could be climate, if we're talking about physical maps of place. It's a concept that I find useful. Okay, just a little bit about the past 4 years, because my map then has changed, my territory has changed from what the map was. So, grieving loss, it's not only death, it's loss of function, loss of place, loss of connectedness with people in a place. And there's always, not always, there is frequently an excitement about the new place we're going to, but we have to do something to metabolize the fact that we have lost something. Sometimes we're grateful to get the hell out of there, and sometimes we're not. So today I'm going to focus on the journey, the illness journey. Most of my experience has been with serious chronic illness. Patient, family, and team travel across time. This is obvious, but it's critical that we understand the role of each person in this patient, family, team does change across time. Some illnesses last years, even decades, and some people have talked with me about they could not comprehend that this is a chronic disease, that it has stages, phases. The developmental perspective looks at changes across time. The person changes. You not only change by virtue of having to adapt to the illness, but the illness changes. By the way, I'm using illness and not disease. Why? Because the disease is talking about the biological problems, right? Illness is everything else around it, how you feel about it, your context, whether you're rich or poor, whether you have insurance, whether you've got the right team, doctor plus others. The family changes. Now, in your handout, I have a small essay. I'd like you to read that, not now, because I stress, I give an example of 3 women at different stages in their lives. Take an adolescent who is diagnosed with Graves. Take a mother of 25 with 2 kids. And take a woman in her menopausal sequence. Each of them is in a different stage of life, and they will be different in terms of how they metabolize what they have to deal with. So that's important. The clinical team changes. They change not only in terms of personnel. For example, let's say you've been seeing Dr. Smith for a couple of years, and he moves from Michigan to LA. Is that right? Was that his sequence? Your doctor, Dr. Smith, who probably is a god to you, is amazing. He talks to you. He listens to you. He knows something about you. This is indeed rare, isn't it? So you have to cope with something like that. He probably was the director of a team there, and he has left, and the whole team is maybe despondent or angry that he's gone. Why did he do this to us? Etc. Then there's another part that's happy for him. And of course, the science changes. This is quite remarkable what goes on. The other serious chronic illness that I've worked with a lot of these, that's been my specialty really, working with persons and families coping with serious chronic illness across time. This is a schematic family. This family doesn't exist anymore. Maybe 20% of American families are like this. Put in a divorce, and immediately everything gets much larger of people who have to adapt. But what I really want to point out here that there are 3 generations. Increasingly, there are going to be 4 generations, right? So that's a lot of people. And serious chronic illness can arise in any generation. For example, I said I work with cystic fibrosis. Most of the diagnoses of cystic fibrosis are made in the first year of life, unless it's picked up with tests at birth, which you can do. Okay, so this girl, let's say, is diagnosed at age 3, and she has 2 siblings. Her relationship with her siblings is markedly changed because she is the sick one. She, quote, drains resources, not only financial, but emotional resources from the rest of the family, the whole family group. Even her grandparents are very concerned with this particular grandchild as opposed to the other 2, and so on. All right, this guy, he's a carpenter, and he notices that he's dropping tools, first subtly and then seriously. And he gets a diagnosis of multiple sclerosis. This changes. Again, the whole configuration. Their dad has this chronic illness, which generally goes in 3 stages. Some brief difficulties, and then it resolves like blindness. That's how it can begin. You have an episode of blindness, and they make the diagnosis, and you never have it again. A second is a kind of chronic undulating course, maybe somewhat like Graves. And a third would be where it just gets worse and worse and worse and worse. So it goes to stages where you have to be wheelchair bound. Okay. Or Dr. Smith talked about dotage, right? He's thinking about it. I guess he's worried a little bit about it. I am here with dotage. I'm going to be 85 next June. So people say, really? You don't look it. Believe me, I feel it. which of course takes me in a lot of directions. But so to come back to the basic issue here, it is a family issue. So when you are faced with coping with Graves, you have to adapt to the changes in the illness. It changes. Different systems are involved, which we learned. Different crises arise. Different decisions have to be made. And when a major decision has to be made, it is complex. If you're an adult and you're married, the kind of decision you're going to make will affect your partner, right? I mean, if you get radioiodine, right, you got to stay away. It may be a couple of days, but suddenly A normal routine, this is just a metaphor really, but a normal routine with this couple who've been together for 20 years has to change. Don't come near me. It's like one or the other had a sexually transmitted disease, you know? I mean, it changes things. Adapting to life's changes. By life's changes, it could be a personal change within you that you're shocked that you'll not live forever without anything going wrong. You'll always be on top of life. And this is a big, you know, others get diseases, but now you have to deal with, I have it, I have it. And what does it mean? Fine-tuning relationships through fruitful dialogue with the self. Namely, you have to face it rather than deny it. Sometimes do stupid things. Now, we all do stupid things. For example, smoking. People with cystic fibrosis have a fundamental lung disease. It affects other systems. But some of them smoke. And some of them, when they have to be on oxygen, they continue to smoke. Now, I can say that is stupid because I was stupid. I smoked 50 years ago. And so did my wife, Marcia. But she was smarter. She quit before, you know, it got through to me. Man, face it, this is going to kill you. Now, I knew this a long time ago because when I was in college, I went to Antioch College, which had a work-study program. It's a very innovative kind of program. And I learned to be a surgical tech. So one of the jobs I had was to work in an operating room. And I used to work at Lenox Hill Hospital, and I scrubbed for a major thoracic surgeon who was doing lung surgery. He'd open up a chest of a smoker, and it looked awful. Now, I was, of course, in scrubs in the middle of surgery, and he would, you know, rail about it. In my pocket, under the scrubs, was a pack of Marlboro. And as he was railing against this habit that's going to kill you, I would sweat. So I get back to the room, you know, after the surgery and so on, get rid of this stuff. No one is looking. I would take the pack out and throw it, you know, put it in a basket. That night I bought a new pack. Okay, that's how hard it is sometimes to do what's good for you. But that's what I mean by self. Also, doctors and staff, intimate others, and other others, because around the family, I keep thinking that the family is up there. I guess I miss my family. That's a psychological leap that I just made. So, everybody's affected. And it comes, for example, I've just experienced this. I was newly diagnosed with spinal stenosis, which means that I have trouble walking. Earlier in the year, I got diagnosed with a autoimmune disease, which affected walking and shoulders. And this past 2 months, I had to make a decision. Do I acknowledge, one of the panelists said, whom do I tell? But I decided, finally, to get a walker, so I'm public. So you guys have seen this old guy, this bearded guy, walking around. What's he doing? Something's wrong. It's true. So the next step on this flight, I decided, you know, I find it difficult to walk, to walk without the walker, without pain. And so I went up to the desk at the airline, Southwest. And I said, I need a blue tag. Surely, sir. No, do you have papers to show, do you have a diagnostic profile? You know, they just accepted it. So I could see as I walked with this blue thing and sat down, people are looking at me. They're resentful. There are people who paid extra to be first and second, and you know how it works on Southwest. Talking with cancer patients or people who've had a heart attack, they tell me that when you, by the way, I'll need your help, I've lost track of time, so give me like 5 minutes, Sai, something like that. Okay. They tell me that people treat them differently. They don't look at you in the same way. You evoke some kind of fear in them. You know, we can talk about what that fear might be like. My God, this can happen to me. Or maybe he will want more of me than I'm not prepared to give. Or if I'm the supervisor, he'll want to get out of certain kinds of jobs. He might misuse, like this guy is faking it, you know, that kind of thing. So those things happen. Again, what you have to deal with. Okay, we did this. Now, the illness has a trajectory, and we learned from Dr. Rose that the processes antecede the actual symptoms and diagnosis, sometimes for years. And so in cystic fibrosis, this data from maybe 7, 8 years ago, I don't know what it is now, the median diagnostic, the time between an experience, a knowledge within the family, there's something wrong with this kid, and the diagnosis, it's about 18 months. And this is bad time for the family. Very often the mom, because let me just briefly digress, some of the early symptoms are frequent respiratory infections. And the mom brings the kid in and, okay, antibiotics and so on, but it keeps recurring. And so the mom is worried. They also are not growing because the gastrointestinal part of cystic fibrosis affects their ability to grow. It's basically a nutritional problem at that time. And so the mom, so again, the pediatrician might think, this is a failure to thrive, a bad mother. A bad mother. And so mothers struggle with this. It's like some of you who have gone again and again to the physician with your symptoms, and you have a feeling that after a while, you're getting dismissed. People are not, the doctor is not listening to you, or not taking you seriously and kind of brushing it off as some kind of psychosomatic sort of thing. How many of you have experienced that? A sense, wow. Well, that's a significant number. So, okay, so that's pre-diagnosis. Now, I do want to say that when you get diagnosed, it's important that you deal that you are PO'd. Is it okay if I say it on TV? Pissed off. Right. You're still carrying that anger at not being taken seriously. What I explained to him or to her, to my doctor, that it was not right, and I know my body. And they just didn't take it seriously for a year or 3 years or whatever. Okay. So it's important that you don't carry this baggage. It's like people who were divorced in a very dysfunctional marriage, and they remarry again, but they still carry a kind of scar. And it's hard for them to maybe give fully to the new relationship because memories of the old are still there. Does that make sense to you? Okay, then there's a diagnostic process and a diagnosis. And as you know, this, who can say to me how long the diagnostic process lasts usually? Is there any kind of, anybody want to tell me that it took a long time? Yes? Okay. So then you have a diagnosis. Paradoxically, getting the diagnosis can be a relief. Does that make sense to you? It does. What people have told me, all kinds of crazy things went through my mind about it, what it could be, and what they were telling me it was not serious, and get some more rest, and etc. Because you finally get a label, and you get the message, we can do something about it. So you feel that you can be competent. Experts tell you things to do, and you're not helpless anymore. So you do what you can. So then come the treatment options. And you know, not all doctors are the same. About 20 years ago, at Harvard Medical School, they have a number of affiliated hospitals. If you were a woman with breast cancer, at one hospital, don't forget, these hospitals were, the physicians were, surgeons, were on the faculty of Harvard, right? Department of Surgery of Harvard. One surgeon they would you know, send these specimen down to the lab, and they said, without a doubt, it's cancer. They would then do a radical procedure. That was what was done. At the other hospital, they had a different philosophy. They sewed up the woman, and you know, maybe 3 or 4 days later, they discussed with her what the options were, what the findings were, and what the options were. One option would be, let's say, chemo or radiation first, and then maybe a radical if necessary, et cetera, et cetera. So what I'm trying to say is that doctors, very well trained, sometimes have different opinions. They have different opinions what the data shows. We should go this way or that way. So that's also a difficult thing. So treatment phase and expectations, I've really been addressing that. And then there are plateaus in any chronic illness. So things are working well, you feel good, the doctor feels good, and then things turn in a different direction, which you have to deal with, right? Let's say exacerbations, like real serious eye stuff. So the point is, there is a trajectory over time, and there are stages, and in between stages, there are plateaus where you're doing pretty well. And these changes, you have to adapt to. The family, well, you remember that. It's important to not generalize. There's tremendous variability in the structure, size, belief systems, explanatory models of disease. I mean, every person usually has a very private view of why this happened to them. They may be right, but they may be way off and suffering, punishing themselves, you know, unnecessarily. Now, smoking is not good with Graves, but if you smoked 30 years ago and quit 20 years ago, is it that likely that that brought on, 20 years after you quit, that triggered Graves? Not very likely. Lung cancer, perhaps. Okay, so whose fault? Is it a punishment? How can we cope? These are common kinds of things that families experience. Healthcare team I won't get into. It's much more complex with cystic fibrosis. because in every cystic fibrosis case, there is a physiotherapist, there is a nutritionist, there is a social worker or a psychologist. And then, of course, there's the doctor, nurse, which is the most common close team. And then there are locales where the illness is cared for, inpatient or outpatient. And then there are consultants. For example, in cystic fibrosis, which is a serious lung disease, the right side of the heart is working very hard to push the blood through the lungs, but the lungs are all scarred. So the right side of the heart enlarges. Well, it's not that frequent, but when that happens, you have to use a cardiologist, right? Or IV medications are done through a port. And so a surgeon does that, inserts that, and so on. So I think it's less complicated in Graves', but the team is important. Each era brings new discoveries. The distance between lab and patient is frustratingly long. Very exciting findings occur, but it's in mice, right? They were able to, for example, in cystic fibrosis, induce cystic fibrosis in mice. Well, it took a number of years to get to the human. So that's what I mean by frustratingly long. And the blurring between hype and hope needs to be lessened. You want to, a doctor like Dr. Smith probably is very direct and tells you how it is. Yes, this is exciting, but usually this kind of thing, when you get to humans, is longer, and then there are stages in getting it approved, and so they're looking 10 years from now. Oh my God, 10 years. Issue of power and control. Who gets to decide what? Because knowledge equals power. The patient, the patient's knowledge helps equalize the power differential between patient and provider. And they have power and control in different domains. Now, it's obvious that the doctor has a great deal of power. And let's say they prescribe an oral medication. It's your power whether you take this medication or not, how much you devote to this routine of self-care. And some people, because they're still struggling with denial that this is, I got this. And my God, it just won't disappear. There is this need almost to deny this. While I'm on this topic, just as we have an immune mechanism physiologically, I believe we have an immune mechanism psychologically. In psycho talk, they call these mechanisms of defense. A common one is denial or projection. These mechanisms, as the immune system, have evolved literally over millions of years in mammals and so on. 5 minutes, thank you. Okay. And just as again, to use Dr. Smith's turning away from dichotomies, but looking at a spectrum, to be paranoid makes sense. When you were a tribe a couple of million years ago, an ape tribe, and you're crossing a piece of land looking for more food, and there's another tribe coming, you know, you get suspicious because you have experience that that tribe 3 years ago tried to kill you guys. So being suspicious is a good mechanism of defense. But if you're suspicious of everything and you don't kind of think about it on that continuum, you're harming yourself. Or denial, right? That's another mechanism of defense. One of the patients here, I forget her name, said, you know, I don't want to think that I got this disease 24 hours a day. There are times when I just want to give it a rest. But to totally deny it, that doesn't make sense. Okay. All right, this is a key slide. You are in the middle. That's you. And you live in a world, a complicated world, where you play certain roles. The nuclear family, right? The extended family. You know these definitions, these are the people, you could be married or living together or whatever, and these are, let's say, the grandparents, okay? Then you have a social network, and you have personal habits and pursuits, and you have a religious, spiritual world, most of us, or you're in school or in a work world. And then you get this diagnosis, and suddenly you become connected in the most deep way with a medical world. Okay. Now, each sector can be a source of satisfaction or stress. I mean, you might be in really serious stress in your marriage, or your mom is dying of cancer. So the point here is that when the balance between support and stress from other sectors in your world gets distorted, you're in trouble and you have to do something about it. Does this slide make sense? Okay. The variability of the disease and the individuality of the patient. Okay, that's obvious, and some of the speakers have talked about that. Now, common psychosocial issues. Adapting to loss of normal function, aiding by adherence expectations, illness progression, the issue of dependence and independence. Like Dorothy stopped by me and said, "Cy, your foot is on the jacket sleeve," and so, you know, now she never. This happens a lot of times. As I was getting off the plane, people saw me, you know, and they had solutions, and I knew that their solutions wouldn't work because I've tried them many times. Okay, so that's the dependence-independence thing. That whole thing shifts with a serious illness. And then, of course, being truthful with the team, because sometimes you don't want to admit that you've not been 100%. And coping with fear, despair, and guilt. You could sometimes feel guilty that in your system, people have had to change their plans, do more for you. Let's say a dad is promoted with a huge increase in salary with a kid with, let's say, Graves' disease. And that kid is being treated by Dr. Smith. And they're in UCLA, and they have this tremendous support system and confidence, right? And the dad and mom don't know what taking this new job is going to mean. Well, that's what I mean. It's something like that affects the family where they have to make some decisions. This is all obvious. Deciding whom to inform, when, and in what way. Living as a person with an illness rather than an ill person. Adapting to the public nature of the disease, the changed behavior, like if you're hyper or your eye signs, and dealing with the concern of others. Dealing with medical and one's own version of Graves, deciding when to think and feel about Graves and when not to, accepting the medical establishment's presumed right to monitor one's thoughts, feelings, behaviors, orifices, and body fluids. That's a huge invasion of the self. But it's a trade-off. You have to do it. Okay, we've heard about using psychological support. Now, this is my final slide. Elizabeth Hardwick was a very, very articulate, sophisticated woman. She was an associate editor of the New York Review of Books, and I just find that a very nourishing kind of journal. The trouble is that abstract knowledge does not quite fit the personal case with its galling concreteness and nasty distance from the universal. Now that says a lot to me, because in the end, it is so individual, your life and the stuff you're dealing with, that generalities may be somewhat helpful, or maybe sometimes a lot helpful, but it is still, when you get down to the concrete thing, it's painful, it's a lousy disease. And as Dr. Smith said a number of times, something that a lot of doctors are not able to say, we just don't know that much about it, but we do the best we can. Thank you very much.